About 50 million people in the United States have allergies, and some of you are probably here today. Yet, there is no drug available to prevent human IgE production. Instead, all existing drugs act to prevent the pathologic effects of IgE after it has been produced. We're studying the pathways and mechanisms leading to IgE production. It's well known that CD4 positive T cells and their cytokines, IL-4 and IL-13, are required for human and rodent IgE production, and that the signaling molecule P38 MAP kinase is associated with IL-4. In depletion and reconstitution experiments, we discovered that two distinct T cell subsets, CD4 plus and CD8 plus, CD60 plus, CD45RO plus. CD45RO is a memory marker in humans, and CD4 plus and CD8 plus asiallergen-1 positive in rodents, and 6 cytokines, IL-2, 4, 10, 12, interferon alpha, and IFN gamma, all were required for induction of specific memory IgE responses, the responses of human allergy. The human CD8 positive, CD60 positive, CD45RO positive epsilon helper T cell subsets is a minor population that appears in blood during, for example, ragweed allergy season and then disappears. The CD8 positive, CD60 positive, CD45RO positive T cells are typical T cells in that they are TCR alpha beta positive. Virtually all make IL-4, some make IFN alpha, none make IFN gamma, and none make IL-13. Some express complement receptors C3a and C5a. So what does this have to do with the brain and the nervous system? We found that the 11 amino acid neuropeptide substance P and substance P 8 to 11, but not substance P 1 to 4, injected into BPO KLH immunized mice, that's benzopenicillin or keyhole lymphedemocyanin, at the peak of the IgE response, suppressed ongoing BPO-specific IgE antibody-forming cell responses, as measured in ELISpot assay, more than 90%. ELISpot assay measures IgE production, so that's how we know we're dealing with suppression of IgE production. It also suppressed serum IgE levels, as measured in ELISA, more than 80%. The suppression was IgE isotype specific in that IgM, IgG, and IgA responses were not affected. It was dose dependent and it was transient, lasting about 1 week. Substance P also decreased CD8 positive asiallergen-1 ganglioside positive T cells more than 80%, along with IL-4 and IFN alpha. VIP behaved similarly to substance P, but no suppression was obtained with neurotensin, gastrin, somatostatin, or serotonin. Substance P 8 to 11 that was suppressive is Phe-Gly-Lu-Met. Substance P 1 to 4, which was not suppressive, was Arg-Lice, Pro-Lice. Now, while I was trying to figure out what to do with these data and what to do next, I was up in Vata Mausian's office chatting when a neurology fellow walked in, and I said to her, "Hi, how's I see your cold is better." And she said, "It's not my cold, it's my allergies, but every time I get magnetic stimulation of left TPO cortex, my allergies seem to get better. Well, that casual conversation led to all the studies that I'm going to present for the rest of the talk. This table shows the effect of magnetic stimulation of left TPO cortex on serum IgE levels on days 1 to 7 after stimulation. Day 0 is unstimulated, and it's measured in IU per ml, which 1 IU, IgE is measured IU per ml. 1 IU is 2.4 nanograms. It's an itty-bitty amount of antibody that's produced. More than 100 IUs per ml are considered IgE positive. Less than 100 IUs per ml are considered IgE negative. By day 5, serum IgE levels are consistently suppressed, 51 to 75%. More importantly, the treatment suppressed many patients' levels into the IgE negative zone of less than 100 IU per ml, and others approached it. Right stimulation throughout these studies has absolutely no effect. It's always rather boring when we look at those data. And this is this table shows the effect of right stimulation. Here we summarize some of the events that occurred after magnetic stimulation of left TPO cortex, and the humans, of course, IgE positive. The first event was substance P levels increased 4 to 6-fold, and that occurred at 2 to 4 hours as we monitor them. It may have occurred earlier, but we couldn't work early on this. Next, CD4 positive and CD8 positive, CD60 negative, CD45RO negative T cell numbers increased. These are just plain old ordinary CD4 and CD8 T cells. While CD8 positive, CD60 positive, CD45RO T cell numbers decreased more than 80%. As you saw on the previous table, serum IgE levels decreased 51 to 75%, with some entering and some approaching the IgE negative zone. There was no change in IgM, IgG, or IgA, so IgE suppression was isotype specific. The increases in serum substance P and CD positive and CD4 positive and CD8 positive, CD60 negative, CD45RO negative T cells were independent of the IgE status of the subjects, occurring after left TPO stimulation of IgE positive and IgE negative subjects, suggesting maybe a possible regulation of blood T cell ranges by substance P, that would be ranges in general. Right stimulation, again, has absolutely no effect. And this is my last slide. Electrical stimulation of left TPO cortex of BPO KLH immunized rats at the peak of the hapten-specific IgE antibody-forming cell response, as measured in ELISpot assay, or as measuring IgE production, suppressed BPO-specific IgE AFC responses more than 90%. The suppression was IgE isotype specific in that BPO-specific IgM, IgG, and IgA responses were unchanged. It was transient, lasting 1 to 2 weeks. Serum IgE levels were also suppressed more than 80%. No IgE suppression was obtained if rats were recently thymectomized versus sham thymectomized, or had spinal cord sectioned, and I hope sectioned is the right word I'm using, at T1 to 2, or T2. Suppression was not affected if sectioned at T6 or T12. Lastly, in related studies, oral minocycline or doxycycline, small molecules that the literature says readily enter brain, strongly suppresses ongoing human and rodent IgE responses, that is, IgE production and serum IgE levels, with some similar events as I described for the humans. So perhaps, and I should say, again, there were no changes in the other isotypes. So perhaps the same epsilon-specific downregulatory pathway is involved. So, taken together, the results suggest that lateralized cerebral cortical functions can regulate an epsilon-specific pathway, resulting in release of substance P into the thymus, increased export of T cells from the thymus, followed by suppression of epsilon-specific T helper cells and IgE production. Thank you.